Hello, my name is Debbie Arnow. I'm the Academic Program Director for Nursing and Healthcare Leadership in our MSN program at Vanderbilt University School of Nursing. In this session, I will introduce you to our specialty and sort of talk a little bit about career opportunities that you might consider as you graduate from this program. We'll cover our curriculum plan and give you some details about how our education is provided in this specialty. I want to take this opportunity to introduce you to our faculty, and I will cover each one of them so you kind of know what our background is. Dr. Jennifer Barut is a assistant professor of nursing, and she has a background of being an educator, a chief nursing officer, and a chief executive officer in a psychiatric mental health hospital. Dr. Christian Cadle is an assistant professor who is very involved with our community, and especially during the pandemic was a leader in the community in making sure that all those who did not have access to care or vaccines, he was out nearly every day on weekends, really being a leader in making sure that we were reaching all those who needed some vaccines and some guidance in that, in managing the pandemic. Dr. Susie Lemming-Lee is our quality improvement and patient safety specialist. She is dynamic. Graduate from Vanderbilt DNP program, has worked as a quality improvement leader for greater than 25 years, and she is a phenomenal educator and a very personable, someone you can really, that is wonderful at coaching you through these processes. Dr. Dan France is a professor at Vanderbilt University Medical School, and he also works in the School of Nursing. He is not a nurse, but he is an expert on patient safety. He has a background in biomedical informatics, as I mentioned. He's also got a master's in public health, and he too is one of our specialists for quality and our design thinking and innovation program. So he is, again, very well versed on patient safety and quality improvement and design thinking. He has been beneficial to our students in helping them with their projects through that design thinking course. So I know you'll appreciate the expertise he brings to our program. It's important for you to understand what career opportunities that you might consider after you graduate from this program. And of course, we do consider applicants that do not have experience in leadership, but perhaps have a goal of pursuing roles as a mid-level management role, such as a nurse manager, assistant nurse manager, or team leader. But there's also those who graduate from our program and are ready to take on those executive leadership roles, CNO, CEO, COO. Others have been consultants, informaticists, entrepreneurs, nurse educator, patient care director, and quality improvement practitioner. We also offer opportunities in a variety of healthcare settings, and that would be, of course, the first thing that always comes to my mind is hospitals, but there's nurse managed clinics, ambulatory centers, community clinics, community-based agencies are always looking for strong leaders who have experience in what we provide in our program, practice management organizations, insurance companies, and also we have had student graduates who have been in a particular industry, like a biomedical industry or pharmaceutical industry. So I'll go over our program more in depth. I want you to know that we base our program on essential competencies that are important for healthcare leaders, and we do That includes both in our American Association of Colleges of Nursing and also the American Organization of Nurse Leaders. But you will have, you will become competent in organizational systems leadership, quality improvement, and safety. Certainly translating, integrating research into your practice is important. We always want to make our decisions based on the best evidence. Informatics and healthcare technologies continues to grow every year, and of course that's an important part of our program so that you're well equipped to handle those kinds of technologies as they evolve. We do introduce you to healthcare policy and advocacy, interprofessional collaboration for improving patient population health outcomes, and clinical prevention and population health. Our curriculum plan involves 35 credit hours. It is 6 semesters of study, and it's part-time study. We do feel like it's important for our students to work as you continue to apply what you learn in our program and into your work setting, and we find that's very beneficial. It's not required, of course, but I think it is absolutely doable to be able to work and also attend school part-time. Our specialty courses include leadership and advanced leadership, nursing informatics, principles of healthcare finance, strategic planning, quality improvement, and patient safety, organizational behaviors, and one of our most popular courses is design thinking and innovation health. We also have practicum courses that I will speak to in more depth. We do have immersion experiences, both virtual and optional on campus. So we ask the students what their preferences are, and we try to meet those expectations. This is our healthcare plan for our 2022 student cohort entry. As you can see, as you progress through these 6 semesters, the courses are sequential, and they really do coordinate with each semester, sort of springboards off from the previous semester, so that you really have a continuum of learning. Our last 2 semesters are where we have our practicums, and they are management, leadership, and healthcare, and then also organizational systems leadership. Both of these practicums can be done in your work setting or in your local area. That you do not need to be in Nashville. You do not need to be come through the school for that. We will make contracts with the site that you want to do your practicums. We have several teaching and learning experiences. We do have on-campus immersion experience, and it's scheduled for 2 days, and we'd like to have those the first semester so that we are able to interact with you from the very beginning. And then we also have a special immersion in semester 5. This one could be optional virtual. It's in what we do is we ask the students what their preferences are. Would they like to be on campus, or would they like to do it virtual? We also have, our courses are offered in a distance accessible videotaped lectures. There's discussion boards. We have online conferencing through a platform of Zoom. Case studies are always very helpful in applying what you've learned. And then you'll have individual assignments. And again, Practicum 1 and 2 courses are arranged in your local areas, as I mentioned. I mentioned our practicum courses, and there will be 2, as I'm in earlier slides you saw that, and in our curriculum plan. These are rich experiences, and they're really important to your nursing education and your preparedness for your future career goals. And you may not change your career goals as they are, but many of our graduates have made advancements in their career as a leader. Our first practicum is Management, Leadership, and Healthcare, is 210 hours. Our practicum 2 is Organizational and Systems Leadership, and that is 280 hours. The first practicum is really more at a micro level, and you work within a unit or department. And Practicum 2, we try to focus you on a broader view of leadership and have you work with someone who's in has more responsibility outside of one department. It can be done in a variety of healthcare settings. We've had anywhere from just particular departments with directors, managers, CNOs, but we've also had interesting practicums where a student worked with someone who was in an architectural firm, and she was the nursing leader for design. So that was a very interesting practicum for her. These are mentoring experiences. You will have a really positive relationship with your preceptor. We work with the preceptors very closely during the practicum, and so we're always vigilant about how you're doing, what's your progression, how can we support you in what you're doing and be successful. The students do really enjoy the practicums, and several of our students have actually graduated and acquired new jobs almost immediately, and they were a direct result of their practicums. In our Applied Quality Improvement course, you also will have some practicum hours in that, and this is done, your faculty will be your guide through those practicum experiences, and this is an application of quality improvement methodology. This is such an important course because you will need to know how to systematically address things that you identify as issues or your team identifies as issues, and you want to apply those continuous quality improvement methods. There is outcome measurement instruments you'll be introduced to and data collection tools, and it is really a very foundational course for every leader. I mentioned earlier our design thinking and health innovation. This course is a really an exciting course. It's an immersive experience. We really look at the concepts of design thinking. This is not something that as nurses we have been really involved in the past, broadly speaking, but it does give you a systematic approach to doing that creative problem solving and innovation. We do have you innovate a project, and it could be anything. It could be in healthcare, it could be outside of healthcare, but you are introduced to these methodologies and will really turn your thinking around quite a bit. The students who've taken this course have really enjoyed it. And just to quote one, they thought they would never have that much fun in a course in college. So I thought that was very exciting to hear because it really does open up your creativity. So I hope during this time, if you have questions, you'll be able to email me. My email is at the end of this slide presentation. I'm happy to talk with you over the phone. I can talk to you through email, but we're very interested in supporting you in your decision. If you are further interested in Vanderbilt, please just let us know. We're here to be supportive of you. These are other resources that you might consider looking at, our webpage for nursing and healthcare leadership. And then I think it's important for you to see what our mission statement is. And of course, tuition fees and financial aid is also very important. And we do have fantastic student support services. So these are all little links that I would invite you to touch on and see what more you can learn about our wonderful School of Nursing. Here is my contact information, and I do hope to hear from you soon.